Hi, it's Adrian from Dental Artistry, Express Cosmetic Treatment. Well, traditionally when we were creating a new smile or doing dental cosmetics, it could sometimes take several months from start to finish. Now with Express Cosmetics, we're able to cut this down to within 2 weeks. And in certain cases, this is actually very important, using the latest technology and the latest techniques, and also doing everything in-house. We've been able to shorten the time considerably from the start of treatment all the way through to the finish. I'd like to introduce you to one of our most vibrant patients, Tiffany. She actually came to see us. She's actually been on TV on The Bachelor. She's actually also on Instagram and is often seen in the newspaper. And she actually was flying over to the US to be on a TV program, so she needed her cosmetics done in a very short period of time. One of the most important things with Tiffany's case is she used to actually Photoshop her own teeth. She was always very conscious about how she looked. Her teeth were crooked and they were out of alignment, and she used to Photoshop her photos before she actually released them. So let's go through her case now and see how we go from start to finish, and I'll talk to you at the end. So this is Tiffany. You can see from this photo, she's actually got quite a good smile, but she's in the public eye. She gets her photos taken a lot, and she really wants her smile to actually be perfect. From a side view here, you can see just how vibrant she is. One of the most important things is just to do a general checkup and just make sure that her teeth are fine. You can see from this photo that she does have some early decay on her back teeth, and we are going to fix this up. When we look at her front teeth, this is a mirror view, so you can see the upper right hand side tooth, or her upper right hand side tooth, has a lot of wear. She's actually worn that tooth down. She also had trauma to the upper left hand side tooth, and you can see that there's a resin or a composite filling that has some decay there. One of the most important views to actually take is what we call the 12 o'clock view. And this view actually shows that her left hand side front tooth is quite far forward from the other side. And we can see this when we look at this view here, where it looks like one tooth is longer than the other. From this very close-up view, and this is after whitening, so the teeth are a very white color here, you can see the size of that composite restoration and the chips and cracks in the other teeth. So when we're designing a smile, one of the most important things is what we call the digital smile design, and this is when we make sure that the smile is in harmony with the face, not just making sure that the teeth are right. And this actually, when we look at these close-up views, you can see that she's actually got a bit of a canter here. So the biggest problem we have in Tiff's case is that her left hand side actually rises higher and faster than her right hand side, and this is what we call the cant. This is very important for us to actually improve this. We actually use 3Shape or a Trios intraoral scanner to actually scan her mouth, and this is actually an intraoral scan, and you can see this is the computerized or the digitized version of her mouth, and we do planning from this. This is a model of her mouth with her new smile, and we used all the information we gathered from the photos, the videos, and the digital smile design in order to create this. We're of course going to trial this in her mouth and see what it actually looks like. So there you go, you can see now how we've actually tried the teeth in. We've got some close-up views of her trial smile, her first trial smile. We have now done the preparation visit, so you can see Tiff's actually numb, and you can see that her upper left hand side lip, of course, is not really working very well, but we're really going to check this very carefully and make sure it's right. You can see the plane of the teeth look better. So what I've actually done is, when it first went in, I just felt that these teeth were rising a tiny bit. It was going a bit high, okay? So what I did was I took a photo and then I analysed your smile, and then I added just really small amounts, and then I took another photo, then I added a small amount, then I polished a bit. So what I'm really looking at is your feedback more towards the symmetry between the teeth. Check that out! See? So let's look at a quick before and after view. So this is her before and here after, and you can see how the plane of the teeth now all align. One of the most important things is a conversation with the ceramist making, and this is Sue, and we're actually discussing colour here, and she really wanted beautiful white teeth but still looking natural, so we had a long discussion on what would be the best colour and the best shape for her teeth. Here we're actually discussing minor changes, and really we want to finesse these cases so that they're absolutely perfect. So this was her second trial smile. We're just doing a digital smile design on that second trial smile. And we can see from 2 different views here how the new trial smile is actually perfect.
Making the laterals a little bit wider.
Wider is the way to go,
yeah.
Okay, the final porcelain has been made here. You can see the very, very ultra thin porcelain veneers. and this is the porcelain veneers in the mouth. And a real close-up view, you can see how the light reflects off the porcelain surface, and Sue, the technician, has actually designed these so that everything basically looks so natural. Let's look at the before and after video. Well, thanks for watching Tiffany's case, and you can see what an amazing result can be achieved when we actually plan these cases very carefully, and what can be achieved in a very short period of time. If you have any questions, please give us a ring at 1-800-SMILING. I look forward to one day seeing you in the practice.